Well, what are some of the arguments for overriding their autonomy that go beyond sanctity of life? Well, there are three I'd like to comment on briefly, largely because they all indicate some of the problems that are like the problems we talked about in that argument of giving our own soldiers the expectation they're going to return to combat on the ground of reducing their survivor guilt. We talked about what might be a problem in that ethical argument. Here I'm going to outline three problems with some of the arguments given for overriding enemy prisoners' autonomy at a prison like Guantanamo and force-feeding them when they want not to eat and to die. One of the arguments is that, well, they aren't autonomous because they're pretty depressed. Well, it might be that they're pretty depressed or that a lot are. However, what happens in our civilian hospitals? Can patients who are even substantially depressed refuse certain treatments like forced feeding against their will? Answer, absolutely. Throughout the country, persons, even though significantly, substantially depressed, that's not enough to take away their autonomy to choose. So it's problematic that that argument should work for prisoners in Guantanamo. Second example, well, in our own prisons, our civilian prisoners, we can force feed our prisoners. So applying the same standard, equality, right, that's a ground for having the same policy at Guantanamo that we have in our own prisons. Well, any sound ethical analysis doesn't go from what ethicists refer to as the is to the ought. That is to say, because we do this, it should be that we should do this. That's considered an invalid argument. So we can ask and must ask ethically the question, what is the rationale in our prisons for force feeding? And one of those rationales is to maintain order. Well, one can ask them the question, even if that's a valid ground for force feeding, is that a problem at Guantanamo? And one to make that argument that force feeding is justified on that basis would have to show empirically that that's necessary to keep order at Guantanamo. Now, a third argument is that those prisoners who've wanted to stop eating are not freely choosing that, but rather there are some within the prison who are saying that's what they must do. And in ethical terms, that group, therefore, is acting in a situation of inherent coercion. They feel they must do that for any number of reasons, including possibly fear of repercussions to their own families. And therefore, one must force feed them to not allow them to die due to coercion of prisoners within the prisoner. Here again we have a percent question. Let us say that that's true. We can ask the question, how many have to be coerced to justify force feeding all? For example, if there's 100 prisoners all refusing to eat, if 10 or 10% of those are doing this because of coercion, is that enough to justify force feeding the other 90? You see the question here, and again the question of who should make that decision.